Texas is one of the states that allows for freestanding emergency departments. Not every state does. You go to an emergency department and you might be there for 4, 5, 6 hours before you're even brought back for the evaluation. So the nuance of freestanding emergency departments is that it allows for you to not have to go to a high volume hospital that is seeing highly patients and be able to receive urgent care without having to wait for 6 hours. Your care starts from the minute you walk into the door. Well, patients have high expectations about what they're looking to get out of a visit or an evaluation. They expect prompt evaluation, a definitive diagnosis, and an expedited treatment. They don't always understand that all conditions have a definitive diagnosis, that the things that we diagnose often are derived from clinical suspicion and exclusion. One of the main problems that we've encountered in recent years with the overuse of antibiotics is resistance that develops over time by certain bacteria to certain treatments. And when patients have more conclusive way of knowing that what we suspect is true, it makes it easier for them to leave satisfied with the fact that they're being treated for the right type of infection. Viral infections be treated with antiviral medications or just symptomatically, whereas bacterial infections are treated with antibiotics. And that distinction makes a test like the MeMed very useful, because when we are dealing with a patient that has symptoms of an infection, but the evaluation that we do is inconclusive, it provides us an extra level of information to suspect whether that infection is bacterial or viral and treat it accordingly. If we're able to determine that they have a bacterial infection and they're treated more promptly with antibiotics, then there's less chance that they'll develop pneumonia or require hospitalization or need to have scans done or do other studies. The earlier respiratory panels that we were using up to about a year ago would take 45 minutes to an hour for results. And when you have a higher volume of patients, it can delay care and can decrease patient satisfaction. So having a study that can run in a 15-minute time frame is incredibly useful, especially on high volume days or on high volume times of the year, because seasonally there are times of the year where we see more of these patients, and it makes it harder to be able to keep the flow of the ER. So I was actually one of the first test facilities to use the MeMed BV machine. And so shortly after the start of our first facilities using the test, we expanded to the rest of our facilities, because we've realized that the MeMed BV provides enough information and better care for the patient that it should be broadly used. So yeah, we constantly strive to have better equipment, better testing, better resources for our patients in order for them to have the best care that we can potentially provide.